As an integrated care system, we are committed to working together to embed a culture of involvement in everything that we do. To improve services, we must effectively communicate and involve the public, patients, stakeholders, and politicians. Engagement and involvement are part of every stage in the commissioning cycle. We pay particular attention to hearing from people who face barriers to accessing services and have poorer experiences and outcomes. It is essential that we understand our community's needs, challenges, and aspirations. As a core part of developing our joint forward plan, we launched the big Health and Wellbeing Conversation to ensure we took active steps to strengthen public, patient, and clinical voices at place and system level. We've developed 10 key principles for engagement which underpinned the big conversation. We actively sought people's views and experiences of services, brought stakeholders and communities together to have detailed conversations, involved people early to inform our plans, reached out to those whose voices we don't often hear, and gave people a number of ways to engage with us. We used a variety of engagement approaches to involve as many people as possible. This included holding stakeholder events, public events, a survey, online activity including website and social media, focus groups, and community outreach. To ensure inclusivity in our approach, we met and spoke to people of different ages, genders, ethnicities, faiths, and backgrounds. We delivered targeted engagement supported by the voluntary and community sector with people who are often the most disadvantaged in our communities. Our ambition was to have 25,000 interactions with people across the county, including online and face-to-face. With the support of all partners and through the range of approaches used, we exceeded the target, achieving 45,068 interactions. Through our public engagement activity, we heard that people have varied experiences and views of our local health and care services. When it comes to primary care, including general practice, pharmacy, dental, and optometry, people generally have positive experiences. However, waiting times remain a key concern. Among primary care services, GP service users have the most varied experiences. The availability of appointments is the biggest concern. People want more face-to-face GP appointments and express concerns about transport to get to and from their appointments. The negative experiences of pharmacy services are mainly driven by items being out of stock and no substitutes being available, whilst the negative experiences related to dental services are mainly due to a high cost of treatment and difficulties finding an NHS dentist. In secondary care, the availability of appointments is also the biggest concern. People want more joined-up care, with services working better together and improved communications between healthcare providers and between services and patients. They want to be able to access information about their health and to be supported while they wait for appointments. People also told us that they need support and guidance to care for loved ones discharged from hospital and suggested staff could benefit from training to support people with complex conditions. People told us they value services in the community, and most community services were rated positively. However, there is concern about the decline and lack of local provision. People are also worried about the lack of home visits and lack of palliative and end-of-life care. People want more screening services in the community. They also told us that grants for wheelchair services are too limited. We asked people about their access to the internet and technology, and most people said they have a smartphone capable of accessing the internet and have broadband at home. People's biggest concern about using technology to access health and care is how their data will be stored and used, closely followed by the quality of care they would receive by video call. Those living in areas of deprivation are more concerned about the security of video calls and booking appointments through a website or app compared to those living in less deprived areas. When it comes to self-care and lifestyle changes, GPs and pharmacists are considered the best people to provide advice and guidance. Almost 1 in 5 people who responded to our survey had been signposted to self-care, advice or support to make a lifestyle change in the last 2 years. Significantly more people living in the most deprived areas and people from ethnic minorities had been signposted for support to self-care or to make lifestyle changes. To help people stay well, people suggested free or reduced cost gym memberships, better signposting for patients about where they can go to improve their health, and easier access to screening and medical tests. When we spoke to stakeholders and partners, they told us that staff retention and recruitment and collaborative working are vital. They suggested that this could be achieved with better staff benefits, more opportunities for progression, development and training, pooled budgets, better data collection and use, and increased awareness of the benefits of care closer to home and preventative services. Developing a trauma-informed system also came out strongly, and similar to members of the public, they want people to be supported whilst they are waiting for appointments. So, what next, and how do we plan to keep the big conversation going? The health and wellbeing data and what people have told us will continue to inform our 5-year joint forward plan, and any proposed changes to local services will be co-designed in partnership with residents and stakeholders. We have also established a People's Network for residents to continue the conversation, to talk to us about issues that are important to them and their communities. We now have over 400 members registered. Thanks for watching. If you want more information or want to get involved in the big conversation, email stw.getinvolved@nhs.net. And if you want to keep up to date, keep an eye on the NHS Shropshire, Telford and Wrekin website, or follow us on social media.